the key issues that I look at in my research is the intersection between gender and outbreaks. And in Latin America, I've looked at this previously, considering the question of gender and Zika. So in the case of Zika, which is very similar to what we're seeing in coronavirus, it's more likely that women will be infected because they're the ones who are doing the caring role. So they're the ones who are either formerly healthcare workers, and we know that globally the statistics for healthcare workers are about 70% globally are women, but they're also the ones more likely to be in the home looking after children and therefore putting themselves at increased risk of infection. Women are then differentially impacted further on down the line, that the care responsibilities that women perform will either as a consequence of having a family member sick or because of the widespread school closures will mean that women are more likely to lose their jobs because they're more likely to be in precarious employment, but then will take longer to get back into the workforce as well. One of the key things, or the things that happen at the beginning of an outbreak in a health system, is the distortion of the health agenda. And one of the key areas that gets neglected often is issues around maternal health and sexual reproductive healthcare provision. One of the concerns that's been raised globally is around the mandate to stay at home and self-isolate, and what that means for how women may be able to physically access contraception if they're not able to go to shops or clinics to provide it, and how they may be able to access abortion if they're not allowed to go to clinics where it is legal. Now, in the case of Latin America, where 95% of the continent doesn't allow abortion legally, we know it still goes on informally. And so, but if women aren't able to get out of the house, we imagine that a lot of those informal routes will mean that women won't be able to get an abortion as easily as they might have been previously. So this raises a lot of questions around the added risks that women might be taking going forward. Are they going to be going out and risking disease transmission to find such service? Are they going to resort to less safe methods in the home, which is obviously a big concern? And we know, particularly, I was looking at statistics this morning from Brazil, that we're seeing increased rates of domestic violence occurring during this coronavirus outbreak when people are made to stay at home and they aren't able to escape from any abusers. And so if we think there might be increased rates of sexual violence as well, this is obviously going to aggravate this problem a bit further. And then there's one more interesting thing when we think about gender and coronavirus in Latin America, and that is these really interesting policies that have been issued at the beginning of April in Panama and in Peru, where men and women are given mandates to leave their house on separate days. Now, I think there's two things to unpack there. One is it talks about really binary gender identities, so it very much restricts men and women to be two categories. The second part is around what are these men and women going to be doing differently. So, for example, think about the supermarket. If that's one of the areas that people are allowed to go to, are men and women going to be spending the same amount of time there? Are they going to be buying the same amount of items? And how might these locations where we think there might be locations for spreading events with disease, how may gender differences impact on disease transmission amongst different groups? So I guess one key recommendation would be that governments thought seriously around access to health services and access to sexual reproductive health services at the start of this outbreak. So whether that is through delivery mechanisms, whether that is making sure they're at supermarkets, whatever it might be to facilitate access to contraception is really important. The second part, related a bit more to domestic violence, is to make sure that there's provision for where women can go if they feel like they are at risk of domestic violence, whether that be shelters or hostels or safe spaces that these women can go to. And then I think the governments who are implementing these gendered policies around different days going out need to really look at the data coming out of it in real time and really try to understand how men and women may approach daily chores differently and how that in itself might affect disease transmission, and then reassess the policies as they go along.